Hi everybody, thanks for joining us today. My name is Carlo. I'm one of the nurses here at the MST clinic, and I am going to show you how to do a subcutaneous injection for either testosterone or estradiol. So what we're going to use today is a vial of normal saline, which we will use as a substitute for testosterone or estradiol. So the supplies you'll be getting from the Kaiser Pharmacy is usually a 1 ml 25 gauge syringe, which is usually blue in color, and an 18 gauge needle, which is usually pink in color. Now, if you're administering estradiol, you might get a larger syringe, just as an FYI. Other things that you won't be getting from the pharmacy, but you probably will need, alcohol swabs, which you can get at your regular pharmacy or even at the Kaiser Pharmacy. They sell that over the counter. Some Band-Aids, and then if you want, some gauze in case you have some bleeding, but that's more optional. So to start off, the first thing you need to do every time you prepare your injection is to wash your hands to minimize the risk of infection. So just get some regular soap and water and wash your hands. Now that I've washed my hands, we can go ahead and set up and prepare our injection. So we'll use normal saline. Your vial should come with a cap, a plastic cap on it when the first time you get it from pharmacy. So the first thing you do is just pop that open, and it exposes this rubber stopper. It's usually gray in color. What you'd like to do is grab one of your alcohol swabs, tear that open, and then use the alcohol swab to scrub vigorously on the rubber stopper to make sure whatever bacteria is on there, you're scrubbing it off. And you let that dry. So while that's drying, let's talk a little bit about milligrams versus milliliters. It's important to know that milligrams does not necessarily equate to milliliters. So when you're drawing up your medication or your hormone, it's important to know how much milliliters or ml it is that you'll be drawing up. If you can't find it on your prescription box, you can ask the pharmacist to explain it to you. All right, so now that our rubber stopper is dry, we can start preparing. We can start off by peeling open your 18 gauge needle, keeping it in the plastic to make sure that it stays clean, and then peeling open your syringe. Now for here, we really only need the syringe. So you can twist to the left to loosen the syringe and take it out, and I like to leave the needle in the plastic, that way it stays clean. I connect the 18 gauge needle to my syringe. Righty-tighty, you hear the squeaky noise, that means you're set. Alright, so now that the needle is connected to the syringe, you can take off the plastic cap that protects the needle. So what I like to do, sometimes folks like to hold it here, but it's actually pretty unstable at this point. So I like to hold it at the edges and just pull straight back, and that'll expose the needle. What you do is hold the base of the syringe and just jab straight down. So you flip the vial, and then let's take it to the wall. That way you can see it against some contrast with the color. So what I like to do is, I'm not sure if you can kind of see it, but you pull the needle all the way down here. That way you're not going to be sucking in air. And what you do is you just pull down. And what you can see, I'm already sucking in a little bit of air right there, and that's okay. That's expected. And what I like to do to make my life easier is pull the plunger all the way down so I get more than what I need. And that way what I can do is I can flick this air bubble right here all the way to the top. And sometimes it's a little stubborn, but it'll get there. All right, now my air bubble is all the way up here. So now what I can do is I can now adjust my dose to what I need. So in this example, we're pulling up about 50 milligrams of testosterone, which translates to about 0.25 ml of testosterone. So now we can adjust our dose to 0.25 ml. So I can push that back in along with the air, and let me show you where 0.25 is. So this is right here, the big hash mark, that's 0.2. Here's 0.3, and you can see the medium-sized hash mark right in the middle, and that's 0.25. So that's where you want it to be. One thing to add here is that you might notice that there's a tiny little air bubble right there. So tiny little air bubbles like that don't really matter. Sometimes folks get worried that that might hurt them. It actually won't. So it's okay to just leave those alone. Now that we have our right dose, we can switch out our needle to the one that we're actually going to use to inject. So because that is a pretty big, scary needle, one thing that you can do to help minimize accidentally poking yourself is to get the cap, put it on the table, and just use the needle to scoop it. That way you don't accidentally poke yourself. Twist it off, lefty-loosey. You can set that aside, and now you can put on the needle that you'll be using to inject. Righty-tighty, you hear the squeaky noise, you're set. Now you can prep your injection site. So let's talk a little bit about that. And while we do, I'm going to put this aside, leaving my needle and my syringe in the plastic wrap, that way it stays clean. Let's talk a little bit about preparing your injection site. The idea with the subcutaneous injection is that you want to inject into the fat tissue. So generally, places where there tends to be more fat works perfectly well. So the belly tends to be a safe bet. So the one thing to remember when you're injecting is just trying to switch the sides every time you inject, just to give your body some time to heal. So if you're injecting 1 week on the right side, just try to remember if you can inject on the left side the following week. So for the purposes of this demonstration, we're going to use this ball and we're going to inject into this ball and pretend that this is my belly. So grab an alcohol swab, tear that open. Make sure you clean your injection site really well. And while that dries, we can get our needle and syringe ready. So same thing when we were prepping earlier, it's a good idea to hold it at the ends and just pull straight back. Oops, that was a fail. There you go. Pulling straight back. And now this should be dry. And what I like to do is to pinch. Pinching sometimes is helpful and distracting. And I like to go with a darting motion. That way it goes in really fairly quickly. So if I was injecting, I would go, and then once that's in, you then inject. It's okay to go all the way in, and it's actually a good idea to go all the way in. And once you're done, just pull straight back, and that's it. So just a couple notes. Once you've uncapped your needle, make sure to not let it touch anything. If by any chance you dropped your needle, or it touches this end of the surface, or you drop it on the floor, it's a good idea to just toss the whole thing out, just to be safe and avoid the risk of infection. So now that you've successfully done a subcutaneous self-injection, just a couple more thoughts to finish up. In the next few months, your hormone prescriber might reach out to you and ask you to check your mid-cycle labs. What that really means is that they want to check where your hormone levels are in between shots. So if you're somebody who does weekly injections and you do your shots on a Sunday, then a mid-cycle hormone level would be you checking your levels on a Wednesday or a Thursday. Basically, somewhere in between you doing shots. The other thing is the possibility of reactions. So you are poking through skin, so there is always the risk of infection. So if you do notice redness, irritation, or swelling, or possibly even an allergic reaction, it's a good idea to just reach out to your hormone prescriber so they can manage the condition as appropriately. So the last thing is needle disposal, because you don't want to toss the sharp needle in regular trash, because there's always a possibility that then folks who clean up the trash get accidentally poked. So you should pick up a sharps container, disposal container from your Kaiser pharmacy. It's a fairly small hard plastic container that's red, and it's specially made for sharps. And you can dispose of your sharps that way. You can call if you need help finding locations where you can then dispose of your sharps container. You can call the Mist Clinic and we can help you find local resources.